LOMOIR CPSD E543390004. 501 are Ensemble Health Partners. Questions and answers with verified solutions 100% correct. Advanced Beneficiary Notice, ABN. AOE, a Medicare form used to inform patients that a scheduled service may not meet medical necessity criteria and may not be covered. The patient acknowledges this by signing the form. Average Generally Billed, AGB. Heavy check mark, a metric calculated annually by each organization based on prior year payment data used to determine amounts billed to patients. Ambulatory patient. OEOE, a patient who is able to walk and is not confined to a bed. Ancillary. Heavy check mark, refers to diagnostic or therapeutic services such as lab tests, radiology, physical therapy, or pharmacy. Assignment of benefits. OEOE, a form signed by the patient allowing the provider to bill the insurance directly and receive payment. Ambulatory Payment Classification, APC. Heavy check mark, a Medicare/Medicaid billing system used by hospitals for outpatient services, assigning payments based on procedure codes. AS400. OEOE, a registration system used in the Lima market region-specific system. Ambulatory Surgical Category and Groupers, ASC/ASG. Heavy check mark, grouping of outpatient surgical procedures by complexity and CPT code to determine payment. Higher group numbers indicate higher complexity and reimbursement. Authorization. OEOE, an official approval that a specific service or test is allowed by the insurance plan, often required before the service can be performed. 1/2. LOMOAR CPSD 543390004. Beneficiary/member. OEOE, an individual covered under a health insurance plan. Benefit verification. Heavy check mark, confirms a patient's eligibility, coverage, and need for prior authorization. Goes hand with pre-certification. Bundled payment. Medicare bundled payments for care initiative. OEOE, a payment model designed to encourage collaboration between providers by paying a single bundled rate for all services related to a treatment or condition. Capitation. Heavy check mark, a payment model in which providers receive a set amount per member per month. PMPM, regardless of how many services he patient uses. Case rates. Answer AOEOE. The patient's condition establishes the basis for a single payment for all services provided. This is determined analyzing resource requirements such as equipment, supplies, facilities, clinical professionals, all staff providing care, length of care, and known possible complications. Care path. Answer AOE, Comprehensive Electronic Health Record System, used to maintain a single, continuously updated record for each patient that can be assessed by our provider teams. Anytime, anywhere. THE result is enhanced safety, quality, and efficiency. Clinic. Answer AOE, VOE, facility, or part of one, devoted to diagnosis and treatments of outpatients. Centers for Medicare and Medicaid Services, CMS. Answer AOE, the federal government agency that administers Medicare and federally funded Medicaid programs. Coordination of Benefits, COB. Answer AOE explains how an insurance policy will pay if more than one policy applies. Coinsurance. Answer heavy check mark, a percentage of the allowed contracted amount that the individual is required to pay after the deductible has been met. Commercial insurance. Answer AOE, healthcare coverage that is often purchased from employers or on an individual basis. Powered by TCPDF, www.tcpdf.org. 2/2.